Good afternoon, everyone. We welcome you all to another interesting and thoughtful session of Unsung Heroes. We have three panelists with diverse work profiles in today's session. So, get ready for an insightful conversation and also to hear valuable perspectives. So, let's start the session with the introduction of the panelists. The first panelist is Mr. Take Laling. He has completed his diploma in ophthalmic assistant at RIO Guwahati in 1996. He did a 3-month certificate course in clinical and supervisory skills development course at Arvind Eye Hospital, Madurai in 2004. He has participated in the Indo-Vision Contact Lens Congress in New Delhi in 2008. He had been actively engaged in most of the community outreach programs organized by the public sector and NGOs for the far-flung areas of Arunachal Pradesh and adjacent districts of Assam. So he has a record of screening over 1,770 schools in the state. He has participated in the 28th Low Vision Awareness Program held at LV Prasad Eye Institute in 2012. He has participated in the 9th General Assembly of the International Agency for the Prevention of Blindness held in Hyderabad in 2012. He was felicitated by the ACOIN for contribution to community ophthalmology in Arunachal Pradesh. He was nominated for this felicitation by the State Blindness Control Society of Arunachal Pradesh. So at present, he is working at the TRI HMS Medical College and Hospital, Government of Arunachal Pradesh. He has his private practice since 2005, named Arunachala Optical in Itanagar. So we will have two videos. One video will be his optical store and the other video will be the community screenings that he has done so far. So Harshita, can we have both the videos? So thank you, Harshada. So our next panelist is Mr. Purab Jayesh Kumar Dalal. So he has completed his bachelor's of optometry from Lotus College of Optometry, Mumbai in 2013. He earned his master's degree from Bharathiya College of Optometry, Surat in 2017, securing a gold medal. He underwent specialized training in contact lenses through the exclusive Manicon contact lens course and the advanced contact lens course as well. So, since 2016, he has been practicing independently as an optometrist at his clinic, Sarjanand Eye Care in Gujarat. So his father, Mr. Jayesh Dalal, has established a strong reputation in the optical industry in Gujarat. His experience was invaluable in his early years, providing him with insights. He developed a keen interest in optometry, particularly in contact lenses. He began by fitting basic RGP lenses and gradually advanced to rose-K lenses. Since 2016, he has successfully fitted over 50 patients with various rose-K designs, including scleral contact lenses, while working as an visiting cum contact lens practitioner. He offers comprehensive eye examination and referring and guiding patients for ocular diseases. He has an in-house optical store. He is an academician as well. He does guest lectures and workshops at various institutions, including Bharatiya College of Optometry, Surat, and Diwali Ba College of Optometry, Gujarat. Harshada, can we have his video, please?
Yes, one second.
As an optometrist, what we do.
1, 2, 3, 4.
Come to Brazil, Bruno, come to Brazil. Come to Brazil, Bruno, come to Brazil. Come to Brazil, Bruno, come to Brazil. Come to Brazil.
I come Brazil.
Bruno in Brazil, Bruno came to Brazil. Bruno in Brazil, Bruno came to Brazil. Bruno in Brazil, Bruno came to Brazil. Bruno in Brazil.
Brazil I came.
Thank you, Harshada. So, our third panelist, Ms. Niveda Santaram. So, she has done her bachelor's in optometry from the Light School of Optometry, M.Optom from City University, Ludhiana, FOVDRA-I from Optometric Vision Development and Rehabilitation Association, USA. She is one of the 4 Indians to be certified for the same. Syntronics 101. Australian College of Syntronics, one of the very few Indians again to be certified. So she is the associate member of Optometric Vision Development and Rehabilitation Association, USA, associate member of Australian College of Syntronics, member of Indian Academy of Cerebral Palsy. She owns a vision therapy clinic in Kids Care Pediatric Neurology Center, Chhattisgarh, since 2015. She is the Director Operations for EyeFull Optometry Clinic, Chennai. And as part of EyeFull, she is the consultant optometrist for vision therapy and neuro rehabilitation for Smart Hospital, Chennai, Rawls Autism Center, Nizamabad, and also at Isha Foundation, Coimbatore. And she is the consultant optometrist for vision therapy and neuro rehabilitation for Saoji Vision Care, Nagpur. She is also head of chief operations at Urban Lens 88 Private Limited. She has 15 years of experience in vision therapy and rehabilitation in special children for autism, namely autism, cerebral palsy, ADHD, dyslexia, traumatic brain injury, etc. She has been a speaker in multiple universities in disability institutes, special schools, pediatric therapy centers, conferences, and also in parent support groups. So, can we have her video, please?
Just 1 minute, 1 second.
Thank you, Harshada. So I welcome all the three panelists. So without any further delay, let's get started. Sir, I would like to start the session with Taling, sir. So can you briefly share how your journey of community screenings began, sir?
Uh, since 1995, that was a part of my training course also. Since the training course, I started my community screening. That was in the Assam, neighboring state. From that, every year, almost every year, we mostly in the winter season, we used to make a program for to reach the outreach. That was our slogan, and that we every year almost we have a screening program, either a school screening program or a rural areas. It is our part of our calendar plan. Since then, almost every year we used to do. So we have a, Arunachal is sometimes it's called as a mini India, no? Arunachal is just like a mini India because we have different culture, different language. Every district has got two, three type of tribes. So within my district also, we cannot talk in our own language to each other tribes. So we have a different language, different culture in every district. We have 26 district, but so many different language, different culture. So sometimes it's very difficult to communicate also. It's very difficult to reach them also. Because early days, early days, there is no such a means, there's no such specialty. But even though that was our part of our calendar program, part of the NPCB program, so we have to do that. So we have anyhow we have completed. We used to reach the target because government has set such target that where there is no such specialty, we have to reach there. So in that way, sometimes we went there by foot also. 2 3 days. It took 2 3 days to reach them, and many such hurdle was there. But even though target has been given to us, anyhow we have to reach them. So that also door to door, not in the center,
Okay.
because we are in the scatter way now. Our living style is scatter way. To reach the house to house, it is very difficult task.
Okay. So moving on to Mr. Purab. So Purab, your father had already had a setup in the optical setup. So how did you plan your expansion?
So basically, what I ensured for a smoother expansion or seamless expansion, I conducted and did analysis of the current operation and the market trends in back 2015 when I started my own clinic, I identified the areas which we and my father together wanted to establish optometry oriented services. Like he has a good OPD of RGP and other special soft contact lenses. So I started practicing RGP lenses, and I developed a specialty contact lens clinic, optometry clinic in another area where we focused on personalized dispensing for pediatric as well as pediatric. And sometimes some patient with a retinal evaluation came for low vision guidance also. We initially guided them and given them basic low vision aids. So we found that this type of services are lacking in our current in our current project back in 2015. So I expanded in another area by such thought, and I am successful in doing that, hopefully.
Okay. So moving on to Ms. Niveda, how and when did you start your vision therapy practice, and how did you gravitate towards this? Because 15, 20 years ago, VT was mostly unknown very widely.
Yeah. First of all, thank you, Spandana. Thank you for the introduction and everything. And hi to all the other panelists too. So actually, it started in, I can say 2006 or 2007 when I was doing my graduation. So that time in graduation, they introduced us to basic vision therapy. They taught us all the equipments and everything. But even then, the perspective at looking at VT was entirely different at that time. It was only limited to CAD card, then eccentric circles, broad string, and some flippers, Virgin's flippers or accommodative flippers. So when I was in a private practice also in 2007, we used to do the same things, regular NSBVA and all that. And then in 2009, I joined Vision Aid under the guidance of Dr. Aditya Goel sir. I think that was the time when the perspective entirely changed for me, because it was during those times. I remember he was the only person in the whole country who was actually seeing vision therapy from an entirely different view. And he was actually doing all that with special children, children with autism, cerebral palsy, and everything. So that's when I started understanding vision therapy on a higher level, that it is not just related to your CAD card and flippers, and it's not just related to your eyes, but it's actually more related to your brain. So, and then from 2009, so it started. And then I moved to Bokaro, Jharkhand in 2012. So I did practice vision therapy there too. But coming into a full-fledged private practice actually started in 2015 from Kids Care Pediatric Neurology Center, Raipur.
Okay, okay, very inspiring journey. So, moving on to Mr. Taling, sir. Sir, for how many years have you been doing community screenings, and what kept you motivated to continue, sir?
So, in my introduction, I have already told you that since my career started, since my government service started, since then till now, I am doing this. So, motivated, in case of motivation means, although it was a part of the government job, part of our government program, but even though I personally very much interest to take part in all these things. So, because how much you meet the people, how much you know the tribes, other community, other languages, that will be more important, and more it is it's benefit for the business purpose also. It because just say if somebody talk me in my language in different place, it will be more attractive. It will be more interesting. In such a way that I personally I very much interest to take part in community screening. So whenever it gets chance, I never miss. I try to attend the program. Very interest to meet the different kind of people, different type of people, and different language, different culture, different the different dish also in some most of the places. New dishes is to get also. So it is monotonous to sit in the OPD only, no? It's a very interesting to go outing. This is such like a outing. It is an outing program, just like outing program. I'm watching for the such chance.
Okay. So moving on to Mr. Purab. So having to take over or taking care of an already established setup, do you think it is a boon or a bane? What is your perspective? Purab, you're there?
Purab, you're on mute.
Yeah, sorry. Now can you hear? Yes.
Yeah.
Taking over or managing an established setup can offer both advantages as well as challenges. Because on one hand, it has a strong, solid foundation of infrastructure resources and a good customer base since last 25 years, which my father has established. However, it also comes with the responsibility of maintaining or improving the same existing standards while adapting the potential challenges as like price factor, new trends, and many other things which patients usually don't adapt uh, easily. So it is a challenging at that way also. But somehow it was a good experience, and that I got a good customer support initially from the old database, and then after getting in touch with the nearby ophthalmologist, cornea specialist who sent that referrals for contact lenses. From there, I begin my new patient list, which helps me in optical as well as contact lens business. So it is 50-50. It is always helpful to have a good family support, but to develop it properly and to make it perfectly as per the current scenario it needs proper planning and management, which I do it personally every 6 months. I see what things we should change in our clinic and what things we should do as per the new optometry practice like myopia control and the newer technologies which are coming into the market.
Okay.
Thank you.
So moving on to Niveda. So from your CV, we understand you work across states. So can you describe your work or clinic model in detail?
Because initially, say for example, my graduation, everything had happened in Chennai, and then I moved on to Bokaro. So it was like I gave almost 3 years of my work in Bokaro, and I just left from there. I shifted to Raipur in Chhattisgarh. So in Chhattisgarh, again, it was almost 6 to 7 years working with Kids Care Pediatric Neurology Center. Since my husband has a kind of transferable job, we had to move to Kolkata. But then when I realized that if I had to shift like this and probably, starting up a whole new practice in every new place is going to be a little difficult. And also then I thought that why not be a visiting consultant in places where I travel. So it's a place, it's a kind, where even I get to go out when I have a change, and also you get to see different kind of people in different states rather than stuck up in only one place. Because I don't know, I should say thanks to COVID or not, because post COVID, a lot of things changed when it came to practice, that we started understanding a lot of things can be done online also, whether a review or looking at the patient, even some amount of binocular vision diagnosis also, thanks to a lot of softwares and a lot of other new technologies which have come up. So a lot of things can be done in the whole country. So this is when I realized that rather than expanding in only one city or one state, it'll be really helpful if I move on to other places, especially places, other than South India. Because when it came to Central India or when it came to Chhattisgarh, I remember Kids Care was the only institution where it had all the multidisciplinary team in only one place. Because practically, for a special children, I mean, for parents, it's very difficult to move from one place to other for day-to-day therapies. It's a day-to-day struggle. So that's when I thought that instead of calling people in my place, why don't I travel to their place so that they can avail maximum service?
Okay. So moving to Laling sir. So you had briefly explained in your first question, but still, what are the challenges if you will have to list a few of them in the community screenings when you started off in the early times, sir?
Early days, it was very much everywhere. It was challengeable because road communication was so poor, and moreover, in rural area, you may not get the food item also. You may not get this one. If you hold there also, it will be difficult to get the food. That's also there. But top of that, when I move on to this border area, just like in the China border, 2-3 years back, I went there. Most of them advised me that I should take extra oxygen gas cylinder also, because 15,000 feet from sea level, it will be there will be less in oxygen. I took extra oxygen gas cylinder also, oxygen, and I took advanced Dimox tablet also. I took there. Nothing was happened, but by God's sake, I came back safely. But some people used to get dizziness on this and that thing, weakness. So that also there. If we move to such a high altitude place, we have to take care of the oxygen also, oxygen and tablet, all these things. And I went up to this one, 3 international border up such a or if you see the Arunachal map, eastern part it is bordering to the Myanmar, and westernmost is this one Bhutan and Tibet. So when we reach up to the border area, we find that is almost similar culture, similar tradition culture of that side also. So we have a different culture, different tribe. It is also there, but the different challenges is that the language communication is very difficult, because though we may be same Arunachali, but we cannot talk in single language. We have to talk in either Hindi or English. So it is a challenging job is communicate, how to communicate that old patient, how to communicate that rural area people. That is there. Mostly that one there. Transportation, communication, and such a. Sometimes I used to think, nowadays it is little bit good, because we used to use the ASA workers and self-help group. Nowadays it's better, but early days they are such facilities, such group was not there, so we have to manage it. That was there.
So definitely very challenging it had been. So moving on to Mr. Purab. So Purab, do you think there's a difference in patients flow between a clinic and an optical outlet? If so, do you think an eye clinic get in more patients?
Yes, definitely both clinic as well as optical outlets provides eye-related healthcare needs significantly. But clinically, if we start an optometry clinic, the patient uh, are already trusted, as well as already our existed patients who came up with a particular hope of getting treated by a individual which he or she trust. But if you compare it with an optical outlet, there may be n number of patients or customers. Some may be of window shopping on also. So each and every patient who comes in a clinic has a hope of getting treated or getting treated by particularly this person only, and he has trust. So I think in clinics, patient flow will be relatively less. Along with that, what are the services which you provide is also very important, because if you have a vision therapy as well as contact lens, specialty contact lens, and any other low vision services, the flow will definitely increases. But at a time, that is also a time consuming, so you have to manage your optical patients as well as that patient. So you have to manage that patient accordingly by giving them appointment. So the last point is that you may get a relatively low patient flow in clinic, but it will gradually increase by time. You should have trust, and you should build up trust in your patient about yourself. This will help you in the future.
Okay. So moving on to Ms. Niveda. So in the initial phase, how did you manage to get referrals, and how did you approach the ophthals and other specialities?
Spandana, so actually that was the point why I initially chose a pediatric neurology center, because then I thought that I would start getting referrals from day one, since there were a lot of in-house patients also. So intra referrals was point number one. And then I specifically started meeting people who dealt with special children. So initially, I didn't meet ophthals much, but I met a lot of pediatric neurologists, then special schools, special educators, occupational therapists, physiotherapists, clinical psychologists, because that it was not the main motive was not just to get referrals, but people actually were not aware that there was a service called vision therapy also, which is existent and it can be useful for special children. So it was to create both awareness as well as for referrals. And then ophthals, I mean, I met last because specifically I wanted to meet them for referrals for strabismus and amblyopia. And a lot of hospitals they responded well. They started sending patients also. And here I would specially mention Dr. Ashish Mahobia from Sai Baba Eye Hospital. And I felt that once, if your work is good and if you're able to convey what you're exactly doing to the specialty, whether it is a physiotherapist, ophthalmologist, or neurologist, then definitely they start understanding and they start referring.
Okay. So moving on to Mr. Take, sir. So what are the various locations and places where you have conducted screenings, and also which was the most toughest and challenging one, sir?
Connected means that is we have to we have a plan, means annual plan that this year such district will be covered.
Hmm.
That was there. Every year we used to plan 2 or 3 district or 3, 4, whatever may be that according to the plan we used to cover that area, that district, 2, 3 districts sometimes we used to cover. Screening and set up a new OT setup also required, because whatever we have the diagnosis, whatever we have diagnosis the operable cases, we have to bring that in the center. And planning way, we have to set up the OT screening center and field workers like that. So most of the time, I used to become a field workers. I went to the door to door and pick up operable case and such thing, and that is shifted to the this setup OT, and all these things. We engage in the OT as well as in the field duty, because I have been in the for many years. I have been in the OT as a block anesthesia givers. Na, I have been there. So I was in multiple discipline. I have been engaged there. So target this year also we have 2, 3 district plan to get reach them.
Okay. So moving on to Purab. So in your case, how did you approach the ophthalms for your referrals, Purab?
Yeah, actually, getting referrals is a main part of specialty contact lens fitting. Uh, for that, I used to reach out to mostly all the cornea specialists, especially in my area. Uh, many of that ophthalmologists were existing customers of my father wholesale chain, so that helped me a lot. And initially, I visited their clinic and started doing RGPs, keratoconus RGPs and Roske at their clinic. So by that means, we started co-managing the cases, and I personally developed a trust in a group of 5 to 6 ophthalmologists, which usually give keratoconus treatment and always call me for contact lens fitting post C3R and pre C3R too. So by that means, we have to build up a trust towards the cornea specialist first. First, he gets convinced his patient is attained properly, then only he sends referrals to our private practice. This is my journey. Sometimes they send the patient directly to our clinic from the day one, but initially, to build a trust in the ophthalmology society or ophthalmology where you are working, you have to visit their ophthalmologist, and you have to do patients there directly, and then they will send you from the next 2 to 3 cases if it's there.
Okay,
and
yeah. Go ahead, go ahead.
and you have to approach them very frequently. Means once you have some new products launched, like Rosque has launched oblate design. So I visited each and every optel with that trial set and explained the whole procedure of fitting an oblate and what is the difference between the XL and the oblate XL. So you have to show them the brochures, and you have to do sometimes you have to do live cases also for free at their clinic if they are not ready to trust that design. So this is how we manage our patients, and we develop a good trust with our ophthalmologist around me, and had a good I had a good referral from, especially from a cornea specialist in my area.
Okay. So moving on to Mr. Niveda, so we understand you are visiting different places for treating the children and seeing your patients. So how do you schedule your work? And also, as vision therapy needs multiple visits and follow-ups, how is this addressed? So that I taken a few things into account. First, I see how much of patients that particular clinic has every 20 days or every month. For example, in Raipur, I visit every 20 to 30 days, 2 to 3 days at a stretch, because there are a lot of new patients. And when it comes to specialty optometry practice, I think Mr. Purav also would agree, you won't get like 100 or 200 new patients every time. That is practically not going to happen. And most of them are like you're going to see them again and again for a short or a kind of long period of time. So initial diagnosis, I usually visit personally and I see. And then I have therapist appointed in all the centers. I design the therapy protocol and I also do the review. If certain cases, I do online review, and certain cases I travel, whether it is once in 10 days or once in 20 days or once in 2 months, depending on the clinic's patient's flow. So that is how I plan. Okay, so planning is very important so that you
Yes,
see sufficient number of patients as well, and your
exactly.
travel is
Because,
worth it.
yeah, even if you tell patients to come for a review, they are not going to remember. But you have to remember which patient category you have to call them in what frequency, whether it's going to be a monthly review or a 3 months review. So accordingly, we ping patients and we line up things.
Okay, okay. So there is somebody who does this for you, managing of scheduling?
Yes, yes, yes.
Okay, okay. So moving on to Taling, sir. So can you share the changes that has happened in community screening from the time that you had started and at present, sir? Do you find anything has changed significantly?
Definitely, drastically it is changed now, because I told you the early days it was everything was manual by foot, or everything was self arrangement. Now drastically change is that already we have a mechanism, we have a self help group, we have a ASA workers in each every place. Well in advance we inform them to collect or to approximate patient, or collect such needy person in a particular center. Then appointed day, we have to go there, visit there and screening. Early days, we have to move to the door to door. But nowadays, ASA worker, already they have been trained, and basic train they have. So they brought them in the particular center, and it's made very easy to screen them.
Okay.
So now it's a very drastically changed.
So moving on to Mr. Purab. So what is your take on collaborative practice, Purab?
Uh, yeah, collaborative practice is a has a good scope as on if we talk about the future of optometry. But seeing competitive market in optical field as of now, I feel that if you have a good recognition or good reputation in one area of one district, then you can think of starting a different branch rather than making a collaboration. For that, obviously you need a good family, valuable support, family support, because they will manage that branch operations and all the optical outlets. And as a specialty lens practitioner, what I think that as Niveda ma'am said, that you will not see lots of patients at a time, so you can visit multiple branches if you have open in one city, and you can work there as a specialist. You can call your colleagues in your clinic, but starting suddenly a big collaborative practice is, I feel it's no for this time. Especially if we think of optical interest, because optical industry has become so much competitive, which I personally feel in our area, that many of the online multinational companies have came up with the store in a distance of 2 to 3 kilometers. So that's the point if we talk about collaborative practice in optical side. But specialty, you can start your own branches and you can visit multiple stores if you want.
Okay. So Niveda, same question to you. What is your take on collaborative practice? Anything more that you want to add?
When it comes to vision therapy and neurorehabilitation, I'll be happy to have a collaborative practice because we are treating the children mostly, special children, and it's not like only vision therapy is going to help or only physiotherapy is going to help. And you need to exchange a lot of situations where we have to discuss about the single child. So collaborative practice with a multidisciplinary team, yes, very good. And second thing also worked very well for me. I have a collaborative practice with iFull Optometry Clinic, and one of my friends, my colleagues, close friend, Miss Savita, she's an expert in contact lens, specialty contact lens. So I'm not an expert in contact lens. So I like vision therapy. So we both manage this way. So whenever I get a specialty contact lens patient or a myopia control patient, I call her, and whenever she gets a vision therapy or a neuro rehabilitation case, I take over the case. So this is how we have collaborated, and for me, it has worked really well. So as Purab said, for opticals, yes, I do understand the risk, pros and cons. But when it comes to optometrist, I feel that this kind of inter-referral systems should start rather than, because there's nothing wrong in referring to a colleague. For example, I don't want my patient to travel all the way from some other place, Hyderabad or Chennai to Raipur. Rather, I would refer the patient to one of my colleagues who has a clinic there whom I trust upon. So, and in that way also, I can collaborate with her or him. So, I think collaboration will work well for specialty optometry services.
So definitely it helps the profession and our own tribe. So
Yes.
definitely, I think we should have a very positive outlook on collaborative practice. So moving on to Taling sir, can you share the importance of community works, probably with some case examples from the experience that you have had as primary eye care practitioners? How important is community work, and also why is it important to be involved in community screenings? Probably you can give few pointers so that the younger generation gets motivated and gets involved in community work, sir.
Yes, it is very important because when we reach them in the rural area, most of the patient they doesn't know that sometimes one eye is doesn't have any vision also, very poor vision, but one eye is 6/6. That's why even they don't know that his one eye is not working. When we diagnose, then only they shock to know that my one eye is not at all seeing. That also happen. So in that situation, if we diagnose in the early age, that was better. Na? We can make them vision. So that is one point. And the old age, mostly in the rural area, they doesn't care for vision. They don't want to travel to the hospital. They happily they are suffering. They doesn't need also. So when we reach them, and when we provide them a spectacle free of cost, they are such people. They're very much happy. They're very happy to have this vision because we have to carry the reading glass and approximate spectacle also. That in far-flung area, when we provide a free the spectacle and free reading glass.
Sir, you are on mute, sir.
Uh,
Oh,
sorry.
yeah.
So it's very important to reach them in the rural area. So in when we I used to work in the medical college, but when such people, when this hyper mature cataract people, they reach to our hospital, sometimes it's too late. No? It is a hyper mature, so brown cataract and such thing. So if we reach them in the Indian area, we can diagnose it in the right time. So that is also important, and providing them the awareness, providing them the this one knowledge, the awareness about the vision care, and make them awareness about the safety. These are very much important for in the rural areas. Otherwise, very because of the few neglected that takes vision, no. So it's important to take them make them awareness about the health, eye health, and eye vision care, and such tips also very important for them. So it is very important to reach them in the community areas. Thank you.
So it helps us to give them right care at the right time. So moving on to Purab. So Purab, what are the strategies that you employed in order to advertise your specialty practice in the initial phases?
Yeah, strategies, not as a strategies you can say, because initially when I started as a specialty contact lens practitioner, no one was aware about the rose K contact lens in our area. So what I did, that first few cases I took proper consent from the patient, and I posted their story or their throughout treatment, their contact lens type, their insertion removal videos on social media with their proper consent, and that I showed to different ophthalmologists which I visited, because they were unaware about the lenses which were available other than the basic RGP design initially. I am talking about the back 2013 14. So nowadays, social media is a boom. You can advertise what thing which what you are doing in your clinic. Other than that, you have to contact cornea specialists and give them proper resources related to the products which are available for the irregular corneal patients, contact lens types, contact lens design. You have to take a small uh, RTC, small conference type. You have to start organize one small conference type event for for your area. You can gather ophthalmologists, cornea specialists, as well as colleague optoms, and from that you can get referrals initially. And as I said, that I I started by visiting few ophthalmologist clinic personally. That is the main strategy. Other than this, I one last thing which I want to add in this point, that if you treat one of the cornea specialist patient with a proper guidance and proper contact lens management, we will only refer his colleagues to you with a positive thought that this person is available in our area, and you can send your patient directly to that clinic. So by that means word of mouth is very important. How you build the trust in your ophthalmologist as well as your patient. That is the main strategy you can you are asking about.
Okay. So moving on to Niveda, what were the initial challenges that you faced and how did you overcome it?
Initial challenges, as I told you, I moved mostly to tier 3 and tier 4 cities. So there actually I'm talking about almost 2009 or 2012, those times, people were not aware of much of autism or all this itself. So, and then vision therapy was even more a kind of new language for them, because most of them, including the neurologists, pediatric neurologists, they were all aware of physiotherapy, occupational therapy, or speech therapy, and vision was completely kind of neglected, or people were not aware. So that was one challenge, that is the professionals not knowing the part of it. And parents, when you started explaining to the parents, because social media also was not that as in great demand the way it is today. So it was less. The impact of social media was less at that time. So creating awareness to the parents also was a big struggle, because once they had financially, time wise, they used to keep vision therapy in the last person in the queue. So that used to happen. And so these two things were there. And sometimes, creating awareness among other professionals also was a great struggle, because I remember that time, even because sensory integration and all this is a part of occupational therapy also. So a lot of other specialities, they also do a vision therapy by keeping a candle or using a light, that kind of practice. So it was difficult to convince them also that the vision therapy is beyond this, and it's not just that alone. I guess these three were the major hindrances in a specialty practice related to vision therapy that time.
So how is it now, Niveda, when you compare those times to now? Has it significantly increased? The awareness is much
Yes,
better
yes.
now?
I would
Uh,
say it has definitely increased, especially I think when it comes to tier one cities, yes, definitely the awareness has increased to a great extent. But
mhm.
still, awareness could be more, because once you look at most of the child development centers and hospitals, they will have all the specialities, but how many of the hospitals have vision therapy as a specialty? So I think this is a long way to go. Let's see.
Okay. So, but still you think the weightage to vision therapy is still less?
Definitely, yes.
Is it? Okay.
Yes,
Okay. So then long way to go.
yes.
Okay. So moving to Laling sir, in all these years of community work, I'm sure that you would have encountered several special moments. Can you share a few with us, sir, so that the younger generation gets motivated?
Yes, in community service, uh, there is still lot of problem is there in the management part. Management part, in the sense, sometimes management part is a hurdle for any program, because some the interested that group, interested officer, interested this in charge, sometimes it's not cooperate, so it's very difficult. And management is very important, and mobilization and is also very important, and motivation to the patient for to move towards the hospital, it is also very important. Sometimes it's happened like this. We when they are in their place, but I have diagnosis for this one operable cases. I have diagnosed operable cases, but 100% they doesn't turn up. So just to make them understand and motivate them to move for the operation, move for the hospital, move for the center. It's a very tough job, because old age people, they very understand very slowly, and that sometimes it's difficult to convince them for move for the operation case. It's a challengeable. It is depend upon the skills of the person, how to convince them, and how to make them understand. And sometimes they understood like this also after operation. Most of the patient that doesn't get vision and this and that infection, all the story they already had sometimes. It's difficult to motivate them to move for the hospital. So it is a challengeable job, and one should have a very good skill to convince them and motivate them for the move for the center.
Okay. So a lot of counseling is required.
Counseling is must.
Okay. So is the situation still the same, sir? or has it changed? Has it better from the time that you started to now?
Yeah, definitely better change. Definitely it's better, but still we have difficult to motivate all. So last time many since many years I never seen that 100% turn up. So, though I may diagnose for 100 patient, but sometimes it's turn up 50%, 60% only. So because of the less motivation, because of their that one, their what is called their family members doesn't support. These are there. Even I used to convince their family members and children also, not only to the patient, but their to PVN family. Sometimes their family all family they are asking that is it guaranteed that after operation they will get vision? Then how I can grant them that it will get 100%? I cannot give them a guarantee. So such people also find. So it is difficult to convince the patient as well as their family members and relatives. It is depend upon our skill, depend upon our expertise, how to convince them and how to motivate them for the come to the hospital.
Okay. So moving on to Purab. Purab, can you give us few factors that one should consider while setting up a private practice? What are the main factors that one should take into account before starting a private practice?
Yeah, good question. Actually, I had a whole presentation on this done in COVID times in one of the online webinars. So for online for starting a practice, first of all, the basic things which I remember is the location, where you are going to start. Second thing, you have to analysis the market in which you are starting. So this if you ask, I am not talking about specialty only. If I talk about optical also, then you have to analyze that how much is the paying capacity of the uh, customers which will come in that area. So basically, if we specify in the specialty side, then location where the all the ophthalmologists and cornea specialists should be nearby. Market analysis, is the patient educated that much? Or he will, as Leling sir, Niveda ma'am said, that if the patient will turn up 100% is also a very important factor. Then we can we can plan about financial uh, resources. Is availability of financial resources. Are you capable of starting or renting a place or starting whole setup from the day one? Then we can think about legal terms and regulations which are needed. I want to just share one case, because in Gujarat in 2022 or 23 beginning, there is a new rule. If you want to start a contact lens, if you are not at all optometrist also, a local optician also, you should have a drug license. This is a new rule in Gujarat rule book. So for that, they need MD42 license. You need MD42 license, which you to take from the Surat Municipal Corporation. You apply there and you get that license. They give that license to optometrist as well as optician also. They are not checking qualifications as of now, but you need that license if you want to practice contact lenses. So that licensing part, I'm talking about especially in Gujarat. As of now, if you starting of a contact lens, I have that license for my wholesale department and for my retail outlets also, separate license for each of the different places. So location, financial resources, licensing, market analysis, and you have to be develop like few strategies, or advertisement is a main part before starting private optometry or specialty optometry practice.
Thank you, Purab. Thank you for your valuable input. So moving on to Niveda. So, Niveda, in a couple of previous sessions as well, the panelists have unanimously agreed that having a specialty practice will help them in terms of visibility and also in financially. So, if one wants to start vision therapy in his or her existing clinic, how does he or she go about it in terms of equipment, financial planning? So, how does one start basically a VT practice? Niveda, you there?
I said, yeah, specialty optometry service definitely adds value to your practice because even I don't have an opticals as such. It's only vision therapy and neuro rehabilitation which I do. But if a person wants to start all this in the regular clinic, first they have to decide this that it's going to be a completely individual practice as such, or they want to collaborate with any hospitals or any other people involved in children with special needs. So this is first point. And second point, they need to decide that they want to see regular NSBBA cases, amblyopia, strabismus, or they want to go beyond that, going on to children with special needs or traumatic brain injury. So these three are the first questions that they have to ask themselves that whether they are interested in which kind of practice. And then financially, uh, I would say they need to get in some basic equipments. Bernal has got a lot of equipments, and there are a lot of softwares also provided by a lot of companies, which actually are quite handy and are very useful. But one word of caution I would like to mention here that many people, when it comes to vision therapy practice, they believe that buying a software is more than enough in doing things. That is not so because only one software is not required to cure all the vision therapy issues. So financially, they can plan, they can have at least one equipment for accommodation related activities and fusional ranges. If they have one equipment, either a stereoscope or aperture rule trainer or teneglyph, depending on what they want, or they can get a whole kit also. So first they have to answer those three basic questions within themselves.
So based on that, they start their practice. So moving on to Taling sir, we just saw that you have your opticals as well. So how do you manage it, and what motivated you to start an optical store, sir? Amidst
Yes.
all, yeah.
Yes. When went to the short-term training at Aravind Hospital,
Mm.
that was actually eye-opener for me.
Mm.
Before that, I was not that much of confident. But after having that 3 month short-term training was there, supervisory and skill development, that was there. There I have been placed in all the different department. So there particularly I was interested in the instrument and the optical part. So unofficially also sometimes I enter there and I used to enter in the lab and I make them a friendship and I inquire about there and I learned a lot of things in the optical parts. That was actually not part of my training, but my personal interest was there. So my planning was that when I go back, I may also have this such optical shop. So that's why I have to learn this. So after getting the training, when I came back and I visited the most of the optical shop in our area, and I have visited the where there is ophthalmologist having clinic, and I have visited because I have been here in the this in the capital, in particular this hospital till now. My total since 25 years. Since 25 years, I have been in the single hospital. So I know nook and corner of this area and where is what is going on. That's I know. That when I visited them, I saw so many lacuna, so many deficiencies there. So after having my short-term training, I have full confidence that I can provide them a better service in the optical part also, not only in the refraction part, but I can provide in the optical part also. That because here I have found that many optician they doesn't care about the PD and centering and pitting height. So these things are not there. They're taken care of. So I have decided that I can provide a better service. I have full confidence that I can provide a better service than them. So why not I should have opened the optical shop? That make me my confidence was make me to have an optical shop. So
Okay.
since that 2005 till now, uh, early days, because early days, the patients doesn't know about our profession, because only they knows doctors, only they knows ophthalmologists. They don't know about the ophthalmic assistant or optometrist. What is that? Nobody knows. But nowadays, gradually, they also knowing that optometrists and ophthalmic assistants also there. They can provide better service in the part of refraction and part of optical and spectacle service. So people are knowing now. Gradually, they are knowing now. Early days, though, of course, they knows ophthalmologists or doctors. Other than doctors, nothing. But it's better.
Okay. So moving on to Purab, so can you brief us about how you do the patient record keeping, and also what are the ways that you make your practice or clinic stand out from the rest?
Patient record keeping, initially, I started with a file system, which I used to give to all the specialty lens or all the patient who came directly to me and getting refraction done under my supervision or my father's supervision at my new uh, clinic, which was started in another place. Slowly, I segregated the contact lens data, contact lens patient on another, and shifted to once another software which I maintained. Me and my brother, he has just completed his bachelor's and doing a master's. Yeah, so I have shifted my specialty lens data on another software, and we are using one different software for normal our optical uh, patients. So that software is basically in optical patient, we all usually record refraction date of uh, visit and their PD and all the small stuff as Lellingson described, like fitting height and all that frame measurements. All this I mentioned, which is separated, which makes me stand out of the crowd from the local optician. And other thing which I wanted to ask, I wanted to inform you that if you start a specialty services in your optical store, if you are, it, then it will make you stand out of the crowd definitely. And for that, initially you have to struggle, but with times you will get patience and recognition, and by that means your clinic will be established under a super specialty or one specialty which you can provide to your patient. So slowly, I invested in instruments other than normal AR. Like I invested in a non-contact tonometer, and we are planning for non-metriatic fundus camera too. So by that means we have upgraded our practice with times, and we are improving our clinic.
Oh, definitely valid points, Purab. So moving on to Niveda. So Niveda, we would like to know what was your family's response when you said you will start an independent practice, and also how important is family support, especially during challenging times, Niveda?
I understand because in 2007 I joined a private practice, and that time 2007 I think my pay was almost around 30K. So then I left the job, and then uh, I don't know, because there are a lot of other advantages which you get when it's a private practice. See, when you step out of the comfort zone, initially it's a struggle, but later it's more comfort. Because when it comes to specialty or when it comes to your own private practice, you're the person who decides when you want to see or how much you want to see. Because when you work somewhere, there's no control. If somebody wants to see, want you to see 50 patients per day, you have to see 50 patients per day. But in a private practice, and especially being a mother, it was very easy for me because in a specialty, especially, people don't turn up as just walk-ins. It's going to be more of appointment based.
Correct.
So
More
yeah,
organized.
family's role is definitely important. And I think more than family and everyone, it's like you have to first support yourself. If you believe in yourself and if you convey the same to your family confidently, definitely they are also going to believe. So yes, family, I think it's the most important thing that whether it's a private practice, whether it's a job, anything. I think Laling sir also would agree and Purab also, because without that, I mean, nothing is actually good.
So Niveda, one additional question. So how do you manage home and this travel, Niveda? How do you plan your schedules?
So that's why I chose specialty optometry service, because as I told you, there are not much of walk-ins and it's all appointment based. And being working with children, I also make sure that I don't leave my child alone. So me and my husband, we somehow manage. When he travels, I take off, and when I travel, he takes off. So that's again the importance of the role of family.
Okay, so that seems to be in a perfect sync. So God bless. So so I think we'll conclude this session. So I thank all the panelists for taking time to share their experiences and insights with us. And I'm sure the audience had takeaways that they can implement to grow in their careers and bring a positive impact to the society. So uh, we would like to thank Optician India for the collaboration. So Optician India is one of its kind magazine for the optical industry, retailers and consumers as well. So there are a lot of initiatives that are taken by the magazine to discuss issues and also to raise awareness among the eye care practitioners to improve their business practices. So you can scan the QR code for the subscription and you can stay updated. We would like to thank Optician India once again for collaboration. So, Harshita, can we have the Optician India screen, please?
Is it visible, Spandana?
No, no.
Hold on.
Yeah.
Now?
No.
No.
It's still not visible.
No, no, no.
Hold on.
Yeah, it's visible.
Yeah, okay.
So that's visible now. Yeah. I think those interested can scan the QR code and subscribe Optician India. So thanks, panelists, and thank you, Optician India, for collaborating for the session. So thank you all.
Thank you.
Thank you.
Thank
Thank
you,
you.
Mr. Purab, and thank you, Laling sir. Nice to meet you all too.
Thank you very much.
Thank you. Same here. Thank you.
Yeah.
Thank you, OCI.
Yeah.
Okay.
Most welcome. Yeah.